Here, let me explain the normal laboratory values of drug levels. We call therapeutic index. So first one is digoxin. Digoxin, other name is called lanoxin. Digoxin is a cardiac medication, right? So digoxin therapeutic index is very narrow. So, and it is normal range should be 0.8 to 2.0 nanogram per DL. And some books wrote it is 0.5 to 2. Both is correct. So digoxin has a narrow therapeutic index. So if digoxin less than 0.5 or less than 0.8, it does not work. If digoxin more than 2.0, they can toxicity. And digoxin toxicity is danger for the patient. If patient have a digoxin toxicity, it present with bradycardia, which is lead to arrhythmias, blur of vision, or GI upset like nausea, vomiting, diarrhea, and yellow, hollow around the light. Common sign symptom of digoxin toxicity. So if my patient should take digoxin, we could monitor the electrolyte. Why we should monitor the electrolyte? Because hypokalemia or hypomagnesemia and hypercalcemia predispose to digoxin toxicity. Let me recap it. As I told you, if my patient took digoxin or lanoxin, we could monitor the electrolyte because hypokalemia means potassium level go down, or hypomagnesemia, if magnesium level go down, potassium level go down, and calcium level go up, hypercalcemia, it predispose to digoxin toxicity. Next here, international normalized ratio, shortly called INR. The normal INR should be 2.2 to 3. It is 2.5 to 3.5 if the client has a mechanical heart valves. Next drugs is lithium. Lithium is a mood stabilizer and therapeutic index 0.6 to 1.2. So as like as digoxin, if your patient need to take lithium, we need to check or we need to monitor sodium level. Why? Because hyponatremia increase the risk of lithium toxicity. If patient develop hyponatremia, sodium level if go down, increase the risk of lithium toxicity. NCLEX board frequently asks a question, lithium it is good to take with food. It is good to take with food. If patient have a lithium toxicity, when it is more than 1.2, have a chance of toxicity. At the beginning, patient present with sleepy or proximal muscle weakness, impaired memory, and GI disturbance like nausea, vomiting, diarrhea. If patient has a lithium toxicity moderate, they present with incontinence, hyperreflexia, or Parkinson-like sign and symptom. Even patient develop neurotoxic effect like delirium, convulsion, or ataxia. If patient develop lithium toxicity is very severe, they present with nephrotoxicity, cardiac toxicity, and hypotension. Another medication we use is called phenytoin. Phenytoin is an anticonvulsant, right? And phenytoin normal therapeutic index level should be 10 to 20 microgram per dl. So phenytoin other name is called dilantin. You see dilantin? So if patient have a phenytoin toxicity, usually present with a discolor of urine or gingival hyperplasia. Let me recap it. If my patient need to take anticonvulsant medication phenytoin, we educate them urine color will be discolored or gingival hyperplasia is common. And for NCLEX board, we need to know something about phenytoin. Remember, phenytoin do not give with food, do not take with oral birth control pill. They will not work together. If you are giving this medication IV, you can only give with sodium chloride. Another medication is called theophylline. Another example, aminophylline. Theophylline is a bronchodilator. The therapeutic index is 10 to 20, as like as phenytoin, 10 to 20. Easy to remember. And theophylline particularly causes tachycardia and palpitation. Frequently asking question in NCLEX board. Another medication we use called valproic acid. So valproic acid normal therapeutic index is 50 to 100 microgram per dl. Valproic acid is a anticonvulsant medication, antipsychotic. So if we prescribe valproic acid, it is important to monitor the drug level or blood level because they have a hepatotoxic effect. So if patient have a hepatotoxic agents, we watch for abdominal cramping or may cause suicidal thought. The vancomycin TAF level 10 to 20 as like as phenytoin and theophylline 10 to 20. And other medication is called this is valproic acid anticonvulsant 50 to 100, and this one is vancomycin. Vancomycin TAF level 10 to 20, and vancomycin peak level 30 to 40. And vancomycin is a antibiotics, antimicrobial, and this antibiotics for serious infection. Vancomycin have a ototoxic effect or renal toxicity effect. And also they can cause infusion reaction or phlebitis. So if my patient need to take vancomycin, it is good to monitor vancomycin TAF level. And two more medication, it is good to know for NCLEX board. Acetaminophen. Acetaminophen normal therapeutic range is 5 to 20 microgram per liter. So acetaminophen, other name is called Tylenol. It is the over-the-counter medication. Acetaminophen we should use with precaution if patient have a liver disease, and minimum dose should be 3.5 gram per dl. Another drug is called Mexalf. It is level 4 to 7 milligram per dl. So if the concentration is more than 7, we call Mexalf toxicity. A sign of toxicity, patient present with areflexia. So areflexia is a sign of Mexalf toxicity. If we see this one, we stop the infusion. We assessment the reflexes. Last medication here, gentamicin. Gentamicin is an antibiotics, right? So here, normal therapeutic range is 5 to 10. And gentamicin can cause ototoxicity, neurotoxicity, and nephrotoxicity. Sometimes NCLEX board asks another medication, carbamazepine. It is 5 to 10. And carbamazepine has an anticonvulsant effect as well.